Do you know about estrogen? I'm Stephanie. I'm a nurse practitioner and type 2 diabetic, and I'm here to help you avoid the long-term complications from type 2 diabetes. This month is International Women's Month, and I am highlighting how type 2 diabetes uniquely affects women. So today we're going to talk about estrogen. I'm sure you've heard about estrogen, but I bet you didn't know that it has a lot more functions than just menstrual health. As you know, estrogen is a female sex hormone. Males do secrete it, but it's a lot more abundant in females. It's responsible for ovulation, menstruation, pregnancy, but it also affects our mood as well, specifically in regions of our cognitive function and memory. It helps our bone health by preventing calcium loss, and then it helps our blood vessels stay healthy by staying flexible, right? We don't want rigid blood vessels. That's an increased risk of stroke and heart attack. It also helps our blood sugar regulate better by becoming more insulin sensitive. So as we age, our estrogen starts to decrease and even fluctuates every month. Right before our cycle, our estrogen takes a nosedive, and if you are type 2 diabetic, you probably realize, or maybe you haven't, that your blood sugars are more erratic and higher right before your cycle. You just have less help on board, unfortunately. And as women age, our risk of heart attack increases because of estrogen decreasing. Women actually with type 2 diabetes has a 3 times more risk of having a heart attack than women without diabetes. The good news is it's not all bad. We can actually do some things now that'll keep our heart healthy, prevent bone loss, and just overall help us avoid those complications from type 2 diabetes. And as you probably know, eating a balanced meal is super important, especially eating broccoli, cauliflower, flax seeds, chia seeds. These specific foods are going to help increase estrogen production, as well as exercising on most days of the week, and incorporating weights is going to be super important. The more muscle you have on board, it protects our bones and makes them stronger, and it actually helps us become more insulin sensitive as well. So you're preventing that insulin resistance, helping our blood sugar regulate better, and overall lower that A1C. Sleep is also underrated. We really need more sleep than we think. It helps repair cells, helps repair our bodies. When we're sleeping, we're resting and just getting ready for the next day. And when we don't have a lot of sleep on board, we're actually increasing cortisol, which is another hormone that's very important for stress, but we don't want to keep that elevated. So when cortisol goes up, it just throws